You've probably heard about the new medication a lot of people are talking about called Ozempic, or the specific weight loss approved medication called Wegovy. It's been a diabetic medication for a few years now, but more and more people are starting to take it for weight loss. But is this the right thing for you? We're going to try and help you answer this question today by helping you know what exactly it is, how effective it can be, and most importantly, what kind of side effects you can expect so you can decide if you want to try it. So let's get a little more familiar with what exactly Ozempic is. The generic name for Ozempic is semaglutide. It's been approved in the United States for the treatment of diabetes since 2017. But in 2021, the same medication under the name of Wegovy was approved for weight loss. Now, Ozempic is called a GLP-1 receptor agonist. This means that it stimulates parts in the body called glucagon-like peptides, hence the GLP-1. These receptors do several things that help you not only lower your blood sugar, but also lose weight. They play a role in helping your body produce insulin when your sugars are higher. It prevents your body from releasing as much sugar from the liver, and what it makes most effective for weight loss is that it lowers your appetite and slows down how quickly you digest food. So all this works together when used for weight loss. In fact, it's one of the most effective weight loss medications out there. Recent studies have shown that the average study participant lost between 10 to 15% of their body weight. Ozempic and Wegovy are the same medication, but the only difference between them is the pen that it comes with. Ozempic, when used for treating diabetes, is dosed from 0.25, 0.51, or 2 milligram injections per week. Wegovy comes in a single-use pen with doses ranging from 0.25 milligrams to 2.4 milligrams. The Wegovy pens are the only ones that are actually approved for weight loss. And the studies found that the higher the dose they used, the more weight they lost. Most people do just great with this medication without any significant side effects. However, if you're going to have some issues with the medication, the most common ones are going to be some nausea or vomiting. In my experience, those who get an upset stomach while taking this medication tend to get it within the first couple of days of the injection. It'll last for a day or two and then starts to subside. I've seen the nausea go away completely with people, but unfortunately in some, no matter what they do, they just don't tolerate it. You can also get side effects of diarrhea or constipation, abdominal pain, and heartburn. Because it is a medication designed for diabetes, it is possible that you can get low blood sugars, especially if you're on other medications that can lower your sugars. So those are the main common side effects that we see. Like I said, the most common one is going to be nausea, but there are some things that you can do to minimize it. So let's talk about these. If you remember, one of the things that Ozempic does is slow down how quickly food passes through the stomach. That's the main reason that you can get some nausea. So the first thing that you need to do to avoid this is cut down on your portions. The more you put in your stomach, the longer it's going to sit there, and it's going to make you feel sick. Also, you should avoid eating fried or greasy foods, avoid laying down after you eat, as well as eating slower. We tend to see the amount of nausea depends on the dose that you're taking. One little trick that I learned is that with the Ozempic pen, as you dial between the official doses, it does increase with each click the amount of medication that's delivered. So if after increasing the dose you start to get really nauseated, you can go back to the previous dose and then slowly increase it by a click or two each week until you get to the dose desired. I've seen this be really effective in getting used to the medication without the same side effect. But make sure you talk with your own doctor though before taking any changes in your doses. There is one possible side effect that you need to be aware of, and this isn't common at all, but it has been reported. It does appear that in some, it can increase your risk for a condition called pancreatitis. This is where the pancreas gets inflamed and starts to release digestive enzymes into your body. It can be a very serious condition. So if you start having abdominal pain upon starting the medication, make sure you contact your doctor right away. Now, for the biggest side effect of them all, and probably the one that's going to keep the majority of you from taking it. We've seen that the vast majority of people taking this medication tend to notice over time a significant decrease in their bank account. That's right. Ozempic and the specific weight loss medication Wegovy are super expensive. If you're paying for it all yourself, you're looking at around $900 a month or more. Now, when you're using this for weight loss, most insurances aren't covering it, so it's going to be really hard to pay for it. There are some savings coupons and patient assistance programs out there, so go to the manufacturer's website and look for any savings that you may qualify for. There are some people, though, that should not take this medication. Of course, you should avoid it if you're allergic to it, but also if you have a history of pancreatitis, you should be cautious as it increases your risk of having another attack. There is a group of people, however, that until more studies are done, should avoid taking it altogether. If you have a personal history or a family history of a rare kind of thyroid cancer called medullary thyroid cancer or multiple endocrine neoplasia 2A or 2B, you shouldn't take it. There is a theoretic risk that it can cause cancer in these people. Ozempic or Wegovy have been shown to be effective in helping patients lose weight. Overall, for the majority of patients, it's safe and well tolerated. But honestly, sometimes it's hard to justify the cost. But for some, it may just be the thing to help you lose weight, especially if you're having struggles with doing it on your own. So it's probably worth talking to your doctor about it and see if it's right for you. Even with as effective as it is, it still, though, isn't going to replace making those important changes in your life that are going to give you long-lasting success. Because it is so hard, we've tried to make it easier by showing you in this video right here 6 simple steps that you can do to start on your weight loss journey. It's not an easy path, but it's key to helping you be as healthy as you want to be.